Hello everyone, welcome to my channel Haemodialysis Simplified. This series of small session will explain various aspects of hemodialysis. In this particular session, we are going to discuss about how to select AV fistula needles for AVF cannulation and how to decide on the cannulation site. So this is the normal construction of a AV fistula, arteriovenous fistula. Normally the arteries are deep in place, which we normally cannot see. And the purpose of creating this AV fistula is to increase the blood flow through the vessel, which is superficial to us, called vein. So once the flow through the venous increases, slowly the venous line develop better and it become more prominent and visible. So we will be able to cannulate for long term in hemodialysis. So normally an AV fistula after construction, it takes about 4 to 6 weeks to develop. Again, it depends on the patients. So let's have a look at the various type of AV fistula creations. If you see this picture over here, this is called side to side anastomosis. What is done over here is an artery is dissected out and a vein is dissected out, and side by side an artery and vein is anastomosed. In this, the arterial flow will be flowing through the veins over here, and vein become prominent. Probably this is the best way of creating an AV fistula, because the blood flow to the rest of the hand is not hampered and there will be continuous flow and minimal the so-called steal syndrome because of reduced blood supply to the remaining part of the hand. So this is not the ideal scenario for all the patients. In some cases, if this type of anastomosis side to side is not possible, then we need to look into the end to side. So end to side, there are two types. One is an end of an artery to a side of the vein. Another one over here is an end of a vein to the side of the artery. It's actually, this is a mirror image of each other, and this also is not bad in case if we are not able to get a side to side anastomosis. In the worst case scenario, we will go into the end to end anastomosis. An end of an artery is anastomosed to an end of the vein. In this, the problem in long term is the blood flow to the peripheral hand is reduced because of lesser supply, and patient, especially during dialysis, complain about numbness, lack of sensation on the fistula hand. It's called steal syndrome. So next one, if you look into this, you can see various type of fistula needle available. Normally, this is the standard fistula needle, straight one, either color coded or without much of difference in the length, color coded. So each color signifies a certain size. This is a straight needle commonly used in most of the places. Whereas one of the commonest problem in dialysis is needle stick injuries. To prevent this, there are another type of needle called safety fistula needle, which have a embedded portion in the cannula. Once the needle is removed, the spike or the needle is automatically moving into this particular hard place, where when you remove the needle, you don't see the needle at all. But there is a small technique to remove it, and after that you don't see any needle, and there won't be any needle stick injury. The other uncommon fistula needle is called single needle fistula needle, where if a specific patient is having problem with cannulation or problem with the fistula, where the vessels are not well developed, only one vessel is available. Still we can do cannulating that single vessel with a single needle, where one needle is pricked wherever the available site, then the needle is subdivided into two. Through one, blood is taken out, and through the other, blood is going back to the patient. Over here, the issue is there will be a little sizable amount of recirculation, and sometimes it require a specialized bloodlines which works up expensive. So in the most scenario, these needles are slowly disappearing. Another thing, if you look into the fistula needle, this is not a ordinary needle, in fact, because this is extremely sophisticated cutting and laser sharp in nature. So if you take a needle, there are needles with back eyes, which is the fashion now, meaning there will be a small opening on the flip side of the needle, so the blood flow can be through these bellas as well as through the eyes. So if you look at the fistula needle, if you see here, there are three cutting portions. Tip 1, the tip the marked as 1, which will tear the skin, and portion 2, the side of the needle, which actually tear the tissues, and portion 3 will create a kind of flap. So this will be a laser cut. After the removal of the needle, we cannot see a hole or a puncture site very visibly, and this helps in healing process. So these needles are specially made with lot of precision technology, cutting technology, and extremely good uh, a kind of siliconization to reduce the pain, healing, and there won't be any blood clots around the needle if there is adequately siliconized. Over here, this is another site, as I mentioned earlier, how to needle, where to needle. So this is an anastomosis area. So when we needle, we need to be a little bit observative before needling, and we have to decide where to needle exactly, so that after the cleaning, we need to identify which is a site of needling. So site of needling is very important. Ideally, it is better to have needle two different direction. One needle towards the anastomosis side, where you'll have larger amount of blood flow, and this can be taken as an artery or so-called artery, which move into the extracorporeal set, and through the other needle we return the blood called the so-called vein. So ideally, when we needle, this is the right good fashion where there is very little recirculation over there. One more important thing over here is when we needle, we need to make sure that the tip of the needle is at least 2 centimeters away from the anastomosis site. Otherwise, by accidentally we puncture the anastomosis site, there can be massive bleeding, and this may result in damaging the entire fistula. So this is one thing we need to keep in mind. Another thing is that between the needle tips, say here, this is one needle tip and this is another needle tip. Between the needle tip, ideally there should be about 2 to 5 centimeter distance. So this is a perfect scenario in case of a typical AV fistula needling. So over here, this is an important slide to demonstrate we should have various size of needle in a dialysis unit. Ideally, if you see, most of the dialysis units have only one or at the most two different type of needles in terms of the gauge. So actually there are needle available ranging from 18, 17, 16, 15 and 14. What does it signify over here? The needle size. When we start a new fistula, if you see here, we start with a blood flow of 150 and a venous pressure of 100. Once the venous pressure exceeds more than 150, it is not ideally good to increase the blood flow. So, whereas if the fistula is good, it is better to migrate into 17 gauge. Again over here, if you see the blood flow, you start by 220 or so on, and once you go to 275, then in case you need to increase the blood flow, we need to migrate into 16 gauge. 16 gauge, we can have a starting flow of 275 up to 330. So some patient nowadays have extremely good fistula. We can give the benefit of having good fistula and good blood flow. So we can increase the flow by increasing the dialyzer size. Patient get a better efficient dialysis and a better KT by V. So in that case, it's always better to increase the size of the needle further so that we are giving the fullest benefit of the blood flow to the patient. What is again significant in increasing the size of fistula needle further is in nowadays, because of hemodiafiltration and advanced form of dialysis, people go up to the blood flow of 470 or 480, where you can go with 14 gauge. Overall here, what is significant in increasing the size of the fistula needle according to the blood flow is, suppose we use a smaller gauge needle and keep a high pump speed. Say for example here, we are using a 16 gauge needle and keeping a blood flow of 380 or 390. Here, the tip of the needle inside the blood vessels will act like a mixer grinder blade, which will be rotating extremely high speed with very sharp needle with a small space to for this much of blood to pass through. There will be unseen hemolysis happening because of sharp needle and squeezing of the blood cell through this small needle in spite of the churning of blood pump, which will result in unseen hemolysis, which we will not be seeing by naked eyes. But if you use a smaller needle and larger pump speed, there will be lot of blood vessel damage, and this can be avoided by selecting the needle in the right way. Not only that, constant usage of smaller needle and needling in the same place again and again, the vessel get a little bit elastic and it started getting expanding on long term, and that results in pseudoaneurysm of the patient. So this is another method of how to anchor a fistula needle after it is placed on the vein. So ideally we need to anchor it so safe, because patient sometimes will be sleeping, and ideally after putting a straight plaster or adhesive, we need to have a cross type L-shaped butterfly needle over here so that accidental displacement of needle can be avoided. So this is just to show how to anchor a needle. Another important area over here is the puncture site, which I mentioned earlier. We should encourage to puncture in different sites for different days. For example, here Monday in place 1, Monday in place 1, arterial needle, venous needle. Wednesday in place 2, Wednesday in place 2, arterial needle and venous needle. Friday again place 3, arterial needle, place 3 in the venous needle. So this fashion of needling will actually reduce considerably the pseudoaneurysm, which as I mentioned earlier, on long term result in damaging of a fistula. So this is an ideal way of needling a patient. So when we started doing needling same place and again, the elasticity of the vessel increases, and you can see mild bulging over the needle site, which eventually form into pseudoaneurysm. If there is a single vessel, this type of needling called rope ladder technique also can be tried, but we have to make sure we are needling in different places every time. So we will get a larger vessel develop and this fistula live longer. So this is a lifeline of a patient. So we need to take extreme care to have maximum longevity to the fistula. If you see this particular one, this is the classic way of seeing an aneurysm. This is the aneurysm because of repeated needle puncture over the same site. And if you see here, relatively very less because of rope ladder technique, because various places the needles are placed. Whereas in here, the needle place will be one single space, and the needle will be actually churning inside the vessel on long term, which makes this portion enlarge. And if you see visibly over here, the peripheral side of the vessel will get constricted, and which will result in narrowing, and finally the fistula start get clotting, or this get damaged and patient have to look for another fistula surgery. So this is the importance of choosing the right needle, choosing the right way of needling a patient to have fistula on long term. So that's the end of this small session. Thank you very much, and thanks for your time listening this small presentation. If you really like it, please press the bell button so that you will get anytime whenever I post a new video, you will get it on your system. Thank you very much, and take care.